Hi, my name's Annette, and I'm going to be doing the Pediatric Assessment. Knock, knock. Mom says, come in. Good morning, my name's Annette, and I'm going to be your student nurse for today. When I come in, I notice Jimmy is playing on the floor. Since he's 3, not yet 4, I'm going to be looking for his developmental milestones. He can count to 3. Mom says he can ride a tricycle. He can say 3-word sentences. So those are the 3s that he can do. He can also throw a ball overhead, ride a tricycle, and when I look at him, he's actively playing. He seems happy. When I came into the room, he makes eye contact with me. So toddlers are the only ones that make eye contact with you. Preschoolers and school age do not. Normally toddlers do not. My bad. I'm sorry. If they don't, it could be a sign of developmental milestone problems. So Jimmy's made eye contact with me and acknowledged me, and then quickly went back to playing. So I say to Mom, Mom, I'm here. My name's Annette. I'm the nurse that's going to be taking care of Jimmy today, and I'm just going to be doing a quick head-to-toe assessment. So Jimmy, let's get up and play a game, okay? Let's play Simon Says. Jimmy gets up and is really excited to play. So I'm going to say, Jimmy, Simon says, do jumping jacks. And he does the jumping jacks. This is going to tell me about the 4 limbs, if they move symmetrically and if they move well, and if he follows commands, which he does. Now, Jimmy, Simon says, walk forwards. I watch him walk forward and back, and I'm looking at his gait. His gait looks well. Jimmy, Simon says, touch your toes. So he bends forward and his back is straight. So, Jimmy, Simon says, shrug your shoulders. So I'm going to put pressure on his shoulders to check that there is good movement of the shoulders. Jimmy, you're doing so great right now. Let's go ahead and get you back in bed. I'm going to be using my special listening device so we could both hear your heart and lungs. The first thing, when he gets back onto the bed, I'm going to check his arm bracelet. It says Jimmy Perez, MR number 12345, preschooler. This is correct, and I have the correct patient. The doctor told me that I need to check you, okay? We're just going to have a look to your heart and lung sounds, and he's very excited because Jimmy says he wants to be a doctor when he grows up. So I'm going to start feeling the head. The hair is evenly distributed. The hair is clean and there's no lice. When we first walk in, we're going to look at the hygiene. He has good hygiene. He has clean pajamas. He has clean skin. Jimmy, I'm going to look at your eyes. Open them, please. The sclera is white, conjunctiva is pink. It is moist and there's no drainage. The eyes are equally round, reactive to light, and his eyes accommodate. Now I'm going to be looking at the ears. The ears are normally set. They're cartilaginous. You don't see any drainage. And I'm going to be pulling up and out for a child because he is 3 or older. Looking at the face is normal. 2 eyes, 1 nose, 1 mouth, and normally situated and symmetrical. I'm closing one ear and asking him to sniff and then doing it to the other. This shows a patent airway. Now looking at the mouth, I see that the uvula is midline. Oral mucosa is pink, moist, and good. I see some teeth and no cavities. He can swing his tongue side to side with no problem. Jimmy, can you puff your cheeks for me? And now make a funny face. And he does. Excellent. This shows me that his face is able to move symmetrically. Now I'm going to be checking the lymph nodes and the occipital, submandibular, and sublingual, and there's no problems. He's able to move his head side to side. Jimmy, I'm gonna listen to your heartbeat. to your carotid, one side. They are both equal bilateral. I notice the trachea is midline, and there's no use of axillary muscles while breathing. The chest is normal, with a nice normal rise and fall. The skin is warm, dry, and intact. There are 2 nipples, and they are symmetrically placed. Now I'm going to be listening to your heartbeat. Would you like to listen? He says yes. So I'm going to let him listen first, which is around the 5th intercostal space to the left. And then I'm going to be taking a quick listen. I'm listening for a full minute. But I already checked the vital signs, and everything is great. The rate is 90 beats per minute. Now I'm going to listen to the lungs. There are 8 in the front. Just breathe normally, Jimmy. 1, 2, 3, 4, 5, 6, and 2 on the sides. Now, Jimmy, can you turn for me? 1, 2, 3, 4, 5, 6. Your lung sounds are great. And you are breathing in and out. As you're breathing in and out, I notice normal chest expansion, and everything is symmetrical. Oh, I'm sorry. Now I'm going to listen to your tummy, Jimmy. I asked Mom when was the last time he had a bowel movement. She tells me and describes that it was normal. When was the last time he urinated? She tells me, and everything seems normal with that as well. So as I'm looking at the abdomen, it seems normal. No lesions, no bumps, and it is rounded, normal shaped. Now I'm going to listen to the bowel sounds, and the bowel sounds are present. Now I'm going to press on your tummy, and you need to tell me if it hurts. I'm going to be pressing on the 9 regions. There doesn't seem to be any tenderness or masses that I feel. The skin is warm, dry, and intact. I'm going to pinch a little side, and I'm checking for the turgor. There is no tinting. Everything seems to be normal. The arms move symmetrically, and the worm is warm, dry, and intact. There's no lesions, no signs of abuse, such as fingerprint marks on the arms. Checking the brachial pulse, there is equal bilateral. Then checking the radial pulse, they are also equal bilateral. Looking at the hands, there's no single transpalmar crease. There's no single groin. There's 5 fingers, no web digits, no extra digits, and there is normal cap refill on each nail, and there's a nail on each finger. Same to both hands. Okay, Jimmy, now I'm going to be looking at your legs, okay? Looking at the legs, I do see some bumps and bruises on your shin, but that's totally normal for a preschooler who's recently learning how to walk. The skin is warm, dry, and intact. Checking the pedal pulses, plus 2 equal bilateral. Looking at the feet, there are 5 toes, no webbing, no extra digits, and there is a nail on each toe on both feet, and they have normal cap refill on each nail. I'll put this right here. Sorry. Now I'm going to be looking at the genitals. This is usually the last thing we do in our assessment, moms. Jimmy, you're doing great. Mom, what does Jimmy usually call his private area? And she says pee-pee. Okay. Jimmy, I'm going to be having to take a quick look at your pee-pee, okay? I'm a nurse and your mom is right here, so I'm just going to be taking a quick peek at the pee-pee. And your bottom, just to make sure that everything is okay. This is totally okay because I am a nurse and your mom is right here. But if somebody else was trying to do this, you need to let your mommy know as soon as it happens, okay? Okay. Oh, by the way, I have gloves on. I'm gonna quickly expose the genital area because I see that it's a little embarrassing for him because I'm a girl and he's a boy, so I'm gonna do it quickly for him. I see male genitals and it seems to be normal. I'm gonna take the femoral pulses. They're equal bilateral. Okay, Jamie, can you please roll over for me? I'm gonna need to take a quick look at your bum. There's no problem with the bad side. Skin is dry, normal, and intact. No signs of abuse. And I'm rolling you back over. Okay, Jimmy, everything looks great. So you can go back to playing. I'm going to be at the nurse's station charting if you need anything from me. So I'm going to make sure that the bed is down, the handrails are up. I pull the curtain, wash my hands, and give mom the call. Like, if you guys need anything at all, please let me know. I'll be in the nurse's station. Thank you.